Hello and welcome to the Georgian Fay Center for Healthcare Innovation 2024 PrEP Award information session. My name is Victoria Vasilkiv and I am the coordinator of the award, and I'll start us off with a few housekeeping items. We have time for discussion and questions at the end, so please note that for the lecture portion of this session, participants will be force muted and video turned off. We will re-enable this feature during the question period. Additionally, note that the chat feature is restricted to sending messages only to myself as the host of the meeting and also a co-host, which is Carolyn Shimmin. Should you wish to submit a question or comment in the chat, please direct them to myself. My name is Victoria. To use the chat box, you click the chat button at the bottom of your Zoom app and enter the text where it says type message here. To direct the message to myself, please select my name from the drop-down menu above where you would type the message. If you have any trouble using Zoom during this time, please feel free to directly message me as well. We have auto transcript enabled, so you should see closed captioning for this session. If you want to toggle this off or on at any time, you can do so using the caption button at the bottom of your screen. We will also be sharing a link of this recording to YouTube and also the slides with everyone who has registered. Now I'd like to welcome and introduce our lead speaker for this session, which is Carolyn Shimmin. She is our Patient and Public Engagement Lead at the Georgian Fay Center for Healthcare Innovation, which is Manitoba's Strategy for Patient-Oriented Research, or SPORE, support unit. In this role, she is responsible for all patient and public engagement in health research programs and services offered at our center. I myself am also with the Center for Healthcare Innovation as the Special Programs Coordinator, and among other programs, I coordinate this PrEP Award, which you are here to learn about today. So welcome everyone, and I'll turn it over to Carolyn to get us started.
Thank you so much, Victoria, for the introduction, and thank you so much to everyone who's joining us today to learn a little bit more about our 2024 Preparing for Research by Engaging Public and Patient Partners, or PrEP Award. I'd first like to start off by acknowledging that myself and Victoria and the Center for Healthcare Innovation are located on the ancestral and current-day lands and waters of the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene Suline people, and on the national homeland of the Red River Métis. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. And today, in coming together, we respect the treaties that were made on these lands. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in a spirit of reconciliation and collaboration. And in talking about patient and public engagement, it's really important to acknowledge that Indigenous methodologies, scholars, and researchers are at the forefront, and we should be looking to. And we also believe that patient and public engagement must be grounded in a social justice and health equity lens. So to start us off today, just a little grounding of what patient and public engagement is. So when we're really thinking about engagement, we're talking about people with living experience of a health issue, their caregivers, their families, and their communities being actively and meaningfully involved in decision-making about research. And this is actually, for this award in particular, it's about research before applying for larger research funding. So it's at the priority setting stage, what area of research we should be looking at, the development of your research question, the helping inform the design, and as well as helping inform larger grant applications. And another way of thinking about it is research that's with or by people with lived and living experience instead of for or about them. And it's always good, I think, just to differentiate between participants and partners, and the fact that we are talking about partnership. So, participants are typically people who are being recruited to the study about whom data is going to be collected. So, if you're developing a survey of people around maternal health, and you're asking them questions and collecting that data to inform and to analyze and inform, those are participants, because they don't have any decision making power about the actual research topic or the design of the research project. When we talk about partnership, this really is having people with lived and living experience, informing the decision making about the research. So you can see them as co researchers, peer researchers, part of the team, a part of an advisory group that really helps shape the research project. And so we developed this award was launched back in 2017, and it was actually in response to we had done a survey of Manitoban health researchers, and what we were hearing back was it's really difficult to engage people with lived and living experience at the very early stages when you want to decide what priority area to look at and what type of questions should we be asking and how should we design it and how should we make our grant application. And what was happening is people were saying, I have to go for larger funding and then involve people. But by then, a lot of the big decisions have already been made. And we know for a fact that engaging early in the research process really allows for more shared decision making power and flexibility in the methods and the design. Um, and we really want to be able to compensate people with lived and living experience for their involvement and engagement at these very early stages. So we thought this award was created really to help fund and to be able to compensate and people with lived and living experience for their involvement in the early stages and help you with your engagement of them. And so here is our lovely award that you probably have all seen. So we launched on February 1st, and it will, and I think it closes April 1st of 2024. Um, and so it's this year we also have the Children's Hospital Research Institute as part of one of the sponsored awards. You can visit that link there, that bit.ly link for the application and other materials, and there's slides and video recordings that will be shared with those who registered and will be on our YouTube page as well. So you can come back to this session later on as well. We also have one of our awards in particular is the Dr. Wadaman Srisakuldi Memorial Prep Award. And that's startup funds for patient engagement, specifically in technology, engineering, or data science. So one out of the 5 awards that will be granted this year will be the Dr. Wadaman Srisakuldi Memorial Prep Award, and it's in honor of Dr. Wadaman Srisakuldi, who passed away suddenly back in December of 2021. And she was a really passionate advocate for patient engagement, particularly in data sciences. She was an active member of CHI's Patient Engagement Champions program and our community practice. And she herself was a PrEP award reviewer too. And so we recognize that for patient engagement may be a new concept for many, particularly in the STEM area. And so we really want to encourage people to apply, and you don't have to be an expert in engagement, but just that willingness to begin to engage in this area is what we're really looking for. And we're here to support you in the process of applying. So who is eligible for this grant? Well, first of all, it's open to all Manitoba researchers, students, and community organizations. If you're planning a health research project or program, it aims to involve that aims to involve patients and or members of the public in decision making around research design at the very early projects. The research project is not yet funded, so it's still in the very early stages in design or grant development phase. And previous applicants are always welcome to reapply as well. So some of the assessment criteria that our lovely reviewers take a look at when they are looking at applications. Here's the kind of 6 overall criteria. First of all, there's overall quality, the appropriateness and level of engagement, evidence of commitment to two-way relationships, trauma-informed approaches, and methods for equity, diversity, and inclusion. Some potential impact of engagement on research, those involved, and in a broader context. Looking at the feasibility of what's being proposed, and then also alignment with principles of patient-oriented research and local health priorities. So for the first one, overall quality, we're looking for clarity. So the application is easy to read, the methods of engagement are clearly laid out and logical. All sections and bullet points in your application are explicitly addressed. So you go through and address them all in your application. The scope. So really it's focused on early engagement. So at the priority setting, refining the research question, co-developing the design, and larger grant development. Originality also is something we look at. So there's been demonstrated attempts to consider methods outside of the status quo of traditional health research and really trying to meet people where they're at in order to do research decision making. The appropriateness. So thinking about the planned engagement is or will be chosen or chosen by or co-designed with partners. So a lot of times you can kind of lay out some ideas of methods that you want to use, but of course that openness to have people with lived and living experience have a say in how that engagement will go. So methods address explicitly stated needs, values, and expectations of partners. Partners have significant decision-making power in the research design and the grant development. So collaboration or patient public directed. So it goes beyond the consultation level. If you remember the International Association for Public Participation kind of has at the lower level consultation, which is just getting feedback and input. But we want to move towards kind of collaboration where we're sharing in some of the decision making with people with lived experience. Some of the resources for appropriateness, we have a really neat workbook called the Readiness to Engage workbook. And that workbook offers some critically reflexive practice questions that you yourself as a student or a researcher can go through. But it also gives some tips around how to do internal and external assessment, examine some of the perceptions, values, needs, and priorities, and assess the level of decision-making power you're thinking about and how flexible you are around that. And another resource, of course, is also as far as when we're talking about the levels of engagement. So may be able to involve partners you can show that you're engaging partners at different levels throughout different stages of the research process. But for the application, really focusing on the level of decision-making power and planning the research project. So really outlining what level of decision-making power you think people with lived experience would have at those early stages of the research process. Of course, again, the priority setting, research question, design, and grant development phase. And there's this link here. It's a nice, we do have kind of an intro to patient engagement series, a blog series that you can take a look at that goes through all of the different levels of engagement and what is required for each of those. As far as methods to engage, there's always a variety of methods and for different stages and levels of engagement. We have this nice workbook where we've actually process mapped every phase and stage of the research process And then for every level, whether it's at the consultation, collaboration, or patient directed, there are some suggestions around participatory approaches that you can take a look at and see if it fits with your project. And just concentrating again at the early stages of the research process. Another criteria that we really look at is the commitment to relationships. So, describing how two-way or reciprocal relationships will be built and maintained, how you're going to develop trust, transparency about the research design and grant process, and participation in shared learning. So, kind of demonstrating that aspect. Discuss the bigger picture and how you envision your engagement will impact everyone involved. So you can kind of outline what your expectations or what you're hoping will happen as far as the impact of the involvement and engagement. And that can be on the research process itself, but also on the researchers and the patient partners involved. Another neat resource that you can definitely check out is our Valuing All Voices framework that was actually developed here in Manitoba, and it goes through kind of the core components that community members identified as important to building trust and building good relationships. And it speaks about self awareness, education and communication, understanding and acceptance, trust, and relationship building. For trauma informed approaches, so really, this is about describing what methods you might use for co creating safety when it comes to engagement. So, discussions of safe spaces, you might be using guiding principles for working together. We do have a 4-part knowledge nudge blog series on trauma informed engagement. We also have a few online videos about that as well. That can help you kind of think through what types of little things that you can put into your engagement that will ensure that there's a space for people to be heard and an inclusive space. For equity, diversity, and inclusion is something we also look at. So, discussing how power imbalances will be acknowledged and addressed in the engagement practice, describing methods to ensure that diverse perspectives are included in the engagement, and really explicitly addressing whose voices may not be heard and who may be missing from the conversation, and how you might try to do that or try to involve these voices. And again, there's a link to a great little blog about that and how you can ensure and different things that you can put into practice. The impact of engagement. So, having a plan for how partners will be involved in the decision making processes, describing potential benefits and harms, and plans to provide supports for people. Approaches should provide opportunities for co-learning, capacity building, and co-benefit. And then really considering the bigger picture of the impact of engagement on the research team, organization, and on the field of in the field of research itself. And then feasibility. So being really explicit and but at the same time flexible in regards to plans for engagement. So the number of people that you're thinking about involving, the duration and frequency of meetings that you might be laying out, some of the roles and responsibilities of partners and researchers, how any barriers to involvement, how you might want to address those barriers to ensure that diverse perspectives are being engaged, contingencies for changes to timelines, budget, and budget needs. So that's always something we know with engagement, things change, and you always have to be a little bit flexible and adaptable. So even just thinking through that aspect as well. And as far as resources, we have a great little budgeting tool. It's Excel-based budgeting calculator with a printable one-page budget summary. And it really provides some guidance and suggestions for important considerations. So addressing certain barriers to involvement that people may be facing and that you can factor into your budget, and ensuring that the appropriate supports are accounted for when you are developing your strategy and your budget. And this budgeting tool was again created here in Manitoba, and it was co-designed with patient partners as well as other health researchers, patient engagements folks, and KT folks as well. So it's a neat little tool. Alignment with patient-oriented research principles. So this is really when you're thinking about the project that you're developing together with patients, you're engaging patients as partners, you're focusing on patient-identified priorities. It's something that's going to improve patient outcomes. You might have plans to conduct it by multidisciplinary teams in the future in partnership with relevant stakeholders and rights holders, and that there is an aim at the end to apply the knowledge generated to improve healthcare systems and practices. And that's the definition of patient-oriented research as given by the Strategy for Patient-Oriented Research. That you also are thinking about addressing local priorities. So really make sure that you clearly describe how the research topic or the question or the priorities that you're going to be looking at and deciding together, that they link back to local priorities, whether it's priorities that have been identified by patient public partners, communities, or affected populations, perhaps by local organizations. So Cancer Care, Addictions Foundation Manitoba, Nine Circles, Mount Carmel Clinic, CIRC, all of those different organizations. Or even you can show how it's connected with Manitoba's health system. So Shared Health has a clinical preventive services plan. So you can always kind of just show how your work and your engagement might be linked to these types of priorities. So now preparing your application. This is exciting. So preparing for your application. First of all, a big reminder to write in lay language. So language that aims for grade 6 reading level. And this is because we have a multitude of people who are engaged as reviewers. So we have people with lived and living experience who are engaged as reviewers. We have health researchers, funders, and patient engagement specialists who are all reviewing the applications and all have kind of equal say in it. So try to avoid medical jargon and acronyms and make sure you address all the sections of the application form. There is a limit of 6 pages, and this doesn't include references or optional letters of support. In the application form, you'll notice it's laid out as follows. You'll be asked for a lay summary, project information, engagement activities, patient and public partners, the research team, the impact of the engagement, the funding award budget, and then an optional section for letters of support. And again, for the lay summary, I think it's about 150 words that we're asking for, and really ensure that your summary addresses the following aspects. So just describe how the PrEP award will aid in achieving the engagement goals of your project, how you will engage people with lived and living experience, and specify how their involvement will influence decisions related to your project, then what you hope to achieve through engaging individuals with lived and living experience. And should your application be successful, this summary a lot of times might be used for promotional purposes as well. The project information section, we're really looking for brief lay language description of the overall research area and topic and its relevance to partners, how priority setting, research question and design, and grant development decisions will be made. the specific goals or outcomes of involving partners, and then funding opportunities or agencies the team plans to apply to in order to fund the larger research project. So what are you thinking about moving forward? For the section around engagement activities, we're really looking for clear and detailed description of the planned engagement. So what your goals and objectives are for each engagement activity, the frequency, duration, or number of partners and meetings, the methods for safety and diversity, the supports and or facilitation services you'll have in place, and opportunities for ongoing engagement. For the patient and public partner section, you can talk about who you hope or plan to engage with, how people will be involved as partners rather than participants. Though there are times you can have, especially in areas of rare diseases and so on, where people may have double hats, but really emphasizing the partnership aspect. Planned or completed assessment of external readiness to engage, so the context of potential partners, caregivers, communities, and or engagement. So you're thinking about assessing and doing a readiness to engage assessment. And then the recruitment strategy and how barriers to involvement will be addressed and assessed. In the section for the research team, really it's for a very brief overview of team members and their roles in the engagement, completed or planned internal assessment of readiness to engage. So have you had discussions about how you want to engage and at what level? And then some of the barriers and facilitators that affecting teams' ability to be flexible and adaptable in the early decision making about the research process. So really considering those aspects. For the impact of engagement section, we're really looking at specific research decisions to be addressed through the engagement, the level of decision-making power, or is it at a collaborative, shared decision-making level? Is it at a consultation level? Really being clear about that. Being clear about some of the potential harms and benefits of the engagement, how you're going to address power imbalances, and then specific processes for ensuring partners' perspectives and their concerns and their values are represented and valued in the decision-making process. And as far as the funding award budget, this is really a summary of the costs. Remember, this is $4,000. So describe any additional support, so funding or in-kind that may facilitate the engagement beyond the amount provided by the PREP award. Emphasis on compensation and addressing barriers to engagement is really what we want to see in your budget. Don't include costs that aren't directly related to the engagement. So things like transcription, publication of an article, conference fees for researchers, that wouldn't be considered part of your engagement budget or for this award. And then it's very much optional. It's not required. And will have minimal impact on funding decisions. So, but you can have letters of support that may describe kind of some of the pre-existing relationships or financial in-kind supports you have already put in place. And so some of the relevant PE resources, again, we have the application form, we have some resources in place, and we have the Knowledge Nudge PE blog series. There's over 30 blog posts about patient engagement. So if you have different questions and thinking about different participatory approaches, you can always take a look at those. And then we also have these articles. We have an article on trauma-informed intersectional analysis and critical reflexive questions for teams. So that can help you when you're describing what you're going to do to put in place a safe and inclusive engagement practice. And that it's the same for the Valuing All Voices framework that outlines a framework that was developed here in Manitoba that you can think through how to build trusting relationships. So successful applicants, you'll receive funding for 18 months. You'll receive a free 1-hour consult with CHI's PE team. There's additional fee-based services that are available. So if you're looking for facilitation and so on, you'll be asked to participate in CHI's patient and public engagement lunchtime learning series. So to present once you're done your engagement, and there's also after the 18 months, there's a little bit of a final report just to ask you how the engagement went and things learned and challenges addressed and so on. And even throughout the 18 months too, the PE team is always available to provide advice and support and answer any questions you may have along your journey. Some of our previous prep awards, here's our links to different previous award winners. Dr. Maya Jayaraman was one of our first award members. I think she engaged 12 people in the development of a systematic review of ER wait times. Dr. Natalie Reidiger, she was involved, she did community engagement, large community engagement around the topic of sugar sweetened beverage tax. Dr. Sadish Srinathan did some engagement around outcomes of thoracic surgery. So he engaged people at the early stages to help him design this project. Doctors Christy Whitmire and Kirsten Gerhold actually engaged youth with chronic pain in establishing a longitudinal study, so helping at the early stages of that. Dr. Anna Hudick did some great work engaging people with lived and living experience in the development of a scoping review around engagement. And then Dr. Dylan McKay did some work around engaging people in the design of a clinical trial, I believe around type 2 diabetes. We have a whole blog series. Leanne Dunn was one of our early award winners, and she engaged youth and caregivers around type 2 diabetes. And there's actually a blog series that has the caregiver perspective, the youth perspective, and the researcher perspective of that engagement, which is really neat. And then another opportunity as well, as you start thinking about the budget for your prep award, on March 13th, we're going to have a session on budgeting for patient engagement, and it's going to go through that tool and help you kind of think through how to build an inclusive engagement budget. So that's another resource that's available for you as well. Oops. Oh, and here we are. I think we're at the question period. I will take down my lovely slides to see everyone. I know that was a lot of information. We're going to share the PowerPoint and the recording. So don't worry if there is stuff that you have more questions about. Are there any questions, Victoria?
Not yet, but I'll go ahead and stop our recording and then I will give participants back their ability to unmute.
Yeah.
Second.